Hi, this is Dr. Analyte from thegentledentist.com, and we're located in Shelby Township, Michigan. And we're going to be showing you on Bill. Bill came in, he's got an area of a tooth that had a root canal done in it, and it just has been chronically infected, right? Is that the problem you've had?
Yeah.
Okay, so how long has this been bothering you for like that?
Well, it's been 2 years for the root canal.
A couple years? Okay. So now if we look at this x-ray over here, you can see how there's a dark area right here. He had a root canal done, that's the white area it represents, and he's got that white part right there. That's an old silver point, it's called, and where that silver point is, that those were done years ago. So what we're going to do is we're going to actually do a surgery where we're going to gain access to this area here, clean out this whole area, clean out the infection. We're going to put a type of filling material, not from the top, but this time from underneath, and then bond that in, and then stitch it back up and remove all the source of infection. So that's what we'll be doing today, and we'll show it to you as we proceed. So the area here, this is on Bill right here is the area, and where that infected area is right in this location right here. So we're going to have to create basically lay what's called a flap of tissue back and expose the bone so we can gain access to that bone. And we're going to go ahead and do that now, and we just I'm just going to create a little incision here. It's like, looks like a banana, almost like a banana peel. Where banana peels off, and then we'll just do that. So doing okay, Bill? Okay, good. All right. Yes, there's a little bit of bleeding in here. Suction, please. Just going to feel some pressure now. So we're just taking this back here, and the skin it's almost like a covering that covers over the bone. And this video is just for those who don't mind a little bit of blood.
Okay.
And so right now we've had to go in here and clean out where this infected part of the tooth is. This other root is fine right here, but we resected back, and I'm going to fill part of that root with material, and then we're going to let the bone heal all in here. Okay.
Sorry.
So this is the area where all that bone was gone, and we put a material up in the root here, which is going to help to seal that off.
Yeah, these have.
So we're completed. I put the stitches in. He's got about 5 stitches here holding this flap of tissue in. I also let's cut out a very thin membrane. It's a collagen that goes kind of over that area just to keep that tissue out of the way from going into it too much. And then over time, that big hole is going to heal with bone, which will take probably about 4 to 6 months to start healing in that area. And so what we did for Bill is obviously.
Yeah.
So what we did for Bill was we went ahead and removed that large infection. In fact, when we started opening it, it was starting to have infection in there. But we cleaned all that out. Actually, I used some
You want me to start?
antibiotic and kind of burnished it and pushed it into the bone so I can kill off into the bacteria that were there in that area. And then we used, where we had to cut off part of that root, we went ahead and just created a seal so that I could seal that off, and we stitched it up using a membrane to kind of keep the soft tissues from collapsing inside. So Bill's going to have some swelling in there today. We're going to keep ice on it, and but he's going to find that infection has been kind of leaking out the whole time is definitely going to be resolved. So looking forward to seeing the results. And if you have anything, like for example on you, if you have an area that's been constantly like an old root canal that you had done before, and it's just swelling up at the gum line periodically. If you're not in our area, call your local dentist. If you're in our area, in the Shelby Township area, then you can give us a call at 586-247-3500. Thank you. Have a blessed day.